So I'm going to start by introducing myself. I'm Perla Moussa. I'm a Lamsa ambassador and a Med1 student in the University of Beirut. I'm going to be talking about LGBTQ plus and mental health, specifically in Lebanon. So I'm going to start by introducing the LGBTQ plus community, and then I'm going to be talking about the mental illness prevalence in the community, followed by the hardships faced by these people in Lebanon, stories from people of the community that are Lebanese, and then ways that they could be supported. So the LGBTQ plus is an acronym for lesbian, gay, bisexual, transgender, and queer or questioning. These terms are used to describe a person's sexual orientation or gender identity. The term gay describes a person whose physical, romantic, and or emotional attraction is to individuals of the same gender, and a preferred term for women is lesbian. Bisexual is a person who has the capacity to form physical, romantic, and or emotional attractions to those of the same gender or to those of another gender, and people may experience this attraction in different degrees. It doesn't necessarily have to be a 50-50 attraction. A transgender is an umbrella term for people whose gender identity and or gender expression differ from what is typically associated with the sex they were assigned at birth. Finally, queer, it describes people whose sexual orientation is not exactly heterosexual, but don't really identify by gay, bisexual, or transgender. Not to forget that the plus is simply for people who don't necessarily consider themselves as part of the LGBTQ, but also don't follow the standard sexual orientations that are attributed by society. So a recent study by Stonewall actually found that over the previous year, half of the LGBTQ plus people had experienced depression, and 3 in 5 had experienced anxiety. 1 in 8 LGBTQ plus people aged 18 to 24 had attempted to end their lives, and almost half of trans people had thought about taking their lives. However, it is important to note that being part of the LGBTQ plus community doesn't necessarily mean that you will have a mental illness, but it may mean you are at a higher risk because of the fact that you are facing discrimination because of who you are. So this is why in the next few slides, I'm actually going to be talking about the different types of discrimination that they face in Lebanon. First and foremost, what's very important to mention is that Lebanon still prosecutes LGBTQ plus relations under Article 534 of the Penal Code, which states that any carnal union against the order of nature shall be punished with imprisonment for up to a year. On the bright side, there have been some judges that worked against this article and have tried to steer it away from LGBTQ plus, such as Judge Haaz Sleiman in 2009. He stated that consensual same-sex relations were not unnatural and therefore could not be subjected to legal penalty. Judge Najib Dahdah in 2014 actually rejected a case against transgender women sued under this article, claiming that gender identity is not only defined by legal papers. In 2016, Judge Al-Kantar actually stated that the interpretation of Article 534 should be compatible with covenants and treaties ratified by Lebanon and incorporated in the Lebanese constitution. And finally, in 2017, Judge Rabi' Ma'alouf actually stated that the article does not apply as long as homosexuality is exercised as a right and in a non-abusive manner, in other words, in respect for others, so a consensual relation. However, sadly, in most areas where LGBTQ plus is still a big taboo, this article is still being used because it still exists and people of the community are still being prosecuted for who they are. It's also important to note that in Lebanon, the LGBTQ plus individuals don't have access to equitable healthcare. In 2010, a study revealed that 70% of physicians believe that homosexuality is a disease, and 50% of them wouldn't provide services to a homosexual client. It was also shown that LGBT individuals are at an increased risk of mental health conditions and other less than optimal general health outcomes. Another study revealed that healthcare professionals, especially mental health experts, rely on counseling and sometimes prescriptions of hormones to change one's sexual orientation from homosexual to heterosexual in what we know as conversion therapy, which ultimately leads to real deleterious effect on people from the community. Not to forget that people from the community in Lebanon face a housing crisis. 41% of the LGBTQ plus individuals cannot pay their rent, and 58% report that their homes were damaged in the blast. 35% were forced to relocate or change their living arrangements, and 39% do not have a safe living space. 11% had been forced back with families where many said that they faced abused and unsafe and unaccepting environments. Not to forget that in the past 2 years, the COVID virus was a big risk for everyone, and some people from the community had to leave their homes from the blast and had to be in crowded areas and in crowded homes where they were at a high risk of actually developing coronavirus. Now, a very prominent issue in Lebanon is a lack of freedom of expression and existence for the LGBTQ+ individuals because of how much they are silenced. So in 2018, the Beirut Pride event was actually canceled because of detaining of its organizer. And its organizer, known as Hadi Damia, was accompanied by officers to the police Hbesh station, where he was asked to remain overnight. In 2019, organizers announced that they had been forced to cancel the concert after the palace's management was contacted by security services and multiple parties that issued statements that would threaten violence against the theater and the participants that would be in that theater. So it's clear to say that the Beirut blast had a deleterious effect on the entirety of the Lebanese population, but people from the community had their own struggles as well. Both Mar Mikhael and Gemmayze, known to be safe spaces for the LGBTQ+ community, were destroyed, and lots of people did not feel like they could fit there anymore. Not to forget the places that were completely closed down that were LGBTQ+ friendly. Also, some people from the community, as previously mentioned, were forced to go back to their homes where they were not accepted. And as the unemployment rate increased by 40%, 80% of them were part of the LGBTQ+ community. And finally, mental illness prevalence and symptoms of already existing mental illnesses increased among individuals of the community, including PTSD and others. Now, outing occurs anywhere. It could occur in any country, but it's safe to say that in Lebanon, outing can lead to real dangerous consequences, knowing that Lebanon is not a necessarily safe space for people from the community. This is why it's very important for us not to disclose the sexual orientation or gender identity of an LGBTQ+ individual without their consent. We should always be mindful of the confidentiality and disclosure when someone comes out to us. It's very important for us to be sure to think before we speak. We cannot just accidentally out someone to other people. We should be able to talk to our loved ones, understand their boundaries, understand whether they are out to other people or whether they are still closeted and would rather stay that way. And the most important point is to always remember that it's not our story to tell or our identity to share. It's always best to allow the individual to come out themselves in a safe environment that they believe is safe and to people that they trust. Now, on a slightly brighter note, there have been lots of public figures in Lebanon that just accepted the discrimination and came out and allowed other people to feel heard and feel seen. One of which is Hamid Sinnu. He's actually the lead singer of Mashrou' Layla. This is a band that started in 2008 with lots of concerts all the way through Canada and France and Tunisia and even in Lebanon. And they got lots of follows and lots of shares and subscribes on Spotify and YouTube, but also lots of criticism, specifically from Arab authorities, Lebanese authorities more specifically, as well as religious figures. One important thing that happened to them is that they received death threats along with their fans at a concert that they were going to have in 2018. They were actually sent death threats and the claims of violence, and they had to cancel their concerts because some people actually had groups on WhatsApp and Facebook where they shared what types of weapons they would be using on that day to hurt people. So to prevent bloodshed, they just had to cancel the concert. Another influencer is Mo Khansa. Mo Khansa is a belly dancer and a taboo-busting individual and queer person in the community. He's Lebanese, and he was most known when he released his song Khaif, which was a recreation of Muhammad Abdel Wahhab's song Khaif Aqoul اللي بقلبي, an Egyptian singer. He was challenging the traditional understandings of masculinity and queerness, and he's really he's an individual who really cares about queer representation, and this is what he tries to do with his multi-layered art. So in his music video, this is what actually got him the bigger recognition. He sang the song, kind of talked about his personal experience, all the while belly dancing. Next, Haaz Sleiman. He actually came out in 2017, but he was known in 2007 as Tariq in The Visitor. He was an undocumented Syrian immigrant in The Visitor. And he ended up also recently being part of Eternals, a Marvel movie. And he was the one to play a gay character in Marvel. And he came up with the idea to talk Arabic to his love interest in Marvel. And he claimed that he never believed he would see something like that on such a large platform. And he never would have believed that he would be the one actually acting it out. However, he also claimed that he was close to tears when he realized that governments like in Saudi Arabia and Qatar and Kuwait actually banned the movie because of the displays of LGBTQ+. And he believed that was a real setback and that Arab queerness exists and it should not be masked. And he still claimed that individuals that would want to watch the movie would still watch the movie and they would just have to watch it illegally. Next is Anya Kneez. Anya Kneez is a drag queen. She went all the way from the US back to Lebanon, so from an area that would technically be considered more of a safe space compared to Lebanon. And that was a big step for her because she was going to an area where she wasn't sure she was going to be accepted. And that's why she started drag. She believed that Arab queerness also had to be represented, that it was super important and it had to be talked about, which is why she's a very important person and name in drag. And she creates her own costumes inspired by the Arab tradition and just Arabic singers. And she claims that she wanted to allow for queerness in the Arab world to have a voice. Next is Shaden Esperanza. Shaden is known to be a comedian. But when she started to question her sexuality ever since she was 12. She also said that all the way from her 15th to 19th birthday, all she wished for is that she wouldn't be gay. But when she turned 19, she fell for another girl who she never got to be romantic with in any way. But she came to the conclusion that there was no reason for her to deny who she was because she was part of the community and it's not something she chose. It's just who she is. And her sister had already come out when she was 16. Initially, their parents didn't have the best reaction, especially their father. But eventually, her mother wanted to create a safe space for her daughters, and that's what she did. She made sure to be accepting and to create an environment where they could be themselves. And eventually, Shaden got into stand-up when she was in a pub with a queer event, and she got on stage and told her coming out story, and people liked it. And then organizers started calling her, and then she got more and more political and more known, especially when she got on Instagram and she got a huge following. Next is Joseph Kai. Joseph Kai was actually known after writing his book, L'Inde Tranquille, in 2017. This book was pre-blast, but it featured a queer individual dealing with his queerness as well as his anxieties in a post-apocalyptic stage 30 years after the end of the Civil War. And Kai stresses on the fact that even in an environment, in a family environment where an individual feels safe, he will still feel, or she will feel still alienated in society because of the great prejudice against people from the LGBTQ+ community. And this is why he believes that through his art, he gave kind of an interpretation of queerness and more specifically Arab queerness. Next and finally is Yara El Khawam. Yara El Khawam actually started as a psychology major, but she is now an actress and a Lebanese actress and an influencer. She is a public figure. Yara El Khawam came out to her parents and she got kicked out of her home. She had to battle OCD, anxiety, depression, and suicidal thoughts. She went through a lot, but ended up getting through all of her mental illnesses. And now she gives a voice to queer individuals in the Lebanese community, as well as she's an advocate to mental illness and mental health and women's rights. Now, there are multiple steps that we can actually take to support people in the community. One of which is to stay informed about differences in gender and sex, stay informed about different stories on LGBT and different things that are happening around the world. It's very important to speak up It is hard to speak up in certain instances, but it's very important to do so, even if it's awkward. In areas where individuals are being homophobic, saying things like that's so gay, or just being hateful, it's very important to speak up because we never know who around can actually get hurt and what effect it could have on them. It's very important to speak up whenever we can. It's also very important to listen to the LGBTQ plus youth. The more we give these individuals the ability to speak up and the ability to be themselves, the more they feel seen and heard, and the better their mental health is. They deserve a place in the world just like anyone else. It's also very important to be a role model for kindness and inclusion. Being kind should always be our first priority with whoever we are actually dealing with, and being inclusive of people of different genders and sexual orientations should always be part of our character and our values. It's also important to come out as an ally, regardless of our gender or sexual orientation. You don't have to be part of the community to be an ally. Being an ally just means that you respect these people and you fight for their rights because they deserve to have rights. It could be as easy as speak out for them on social media. It could be as easy as staying informed and making sure that people around you feel safe. Creating a safe space where people can be themselves is a very important matter, because the safer people feel around you, the more they feel like they are not alone. They feel like they are coexisting with other people. It's also very important to support equality and equity. It's very important to make sure that if any policy is discriminatory, we need to talk in school, in work, we need to talk to our peers, we need to make sure that we mention it to someone, we try to do something about it, because it's unfair to be discriminated against for something as simple as being yourself. Finally, we could refer them to NGOs that could be of aid to them. And I'm going to be mentioning a few in the next 2 slides. Feel free to screenshot if you think someone you know needs them or you need them. I've added their numbers and their Instagram accounts. In certain instances, I've added their emails as well. Moussa is a sexual health center. It tests for sexually transmitted diseases, provides medical consults and follow-ups, as well as psychosocial counseling, sex and awareness sessions as well. The SIDC allows for access to care for the LGBTQ plus individuals, male and female sex workers, people living with HIV, as well as drug users. LabMash is an organization of healthcare professionals aiming to achieve equity in health, with focus on sexual health and the health of marginalized groups. Next is Hilm. Hilm is actually the first Arab LGBTQ plus organization. It's an online resource for information and engagement on queer rights and liberation in Lebanon and the Southwest Asia and North Africa. One More Cup is a MENA organization for research, empowerment, capacity development, and unbiased productions in favor of marginalized groups. And Proud, finally, is working to achieve protection, empowerment, and equality for marginalized groups through legal work, raising awareness, and psychosocial work, and others. All of these could be either providing legal consults or mental illness help or sexual testing, or simply the representative of the LGBTQ plus through art. Now, I think this quote applies greatly to this because it says that you cannot do a kindness too soon, for you never know how soon it will be too late. It's very important that whatever we do in our life, it's done in it does a positive impact on the people around us. It should cause a positive impact on the people around us. We never know when someone is on their last straw, they really don't think there's any hope for them, and a simple act of kindness could make them feel less alone, just like a simple act of discrimination could really push them over the edge. So this is the end of my presentation, and if you have any questions, please feel free to ask it, and thank you so much for joining. Okay, so thank you very much. I really hope you enjoyed it. I'm going to be ending it now.
Thank you. Bye.
Bye.